Thank you all very much for being here. My name is Ken Goodman. I have to agree to the recording. And it's a privilege to welcome you to the latest in our Dialogues in Research Ethics series. Now, as you've noticed perhaps by the flyer, in its 32nd year. Professor Schmit is we count them, the 215th in the dialogue. It's one of the longest sustained programs in research ethics, and for that matter, sometimes clinical ethics that we know of. And it's a real privilege to welcome Professor Schmit. So Cason is a lawyer. Yes, we have lawyers participate in dialogues. In our 30 years, lawyers, scientists, physicians, nurses, clergy, philosophy. We even let philosophers in, so that's beautiful. But what's exciting about today's session is that it's Professor Schmit's work in health information technology and public health information technology addresses an area of something that everybody will say very swiftly how interested they are. I was saying earlier that there's a lot of focus on clinical computing systems, on laboratory systems, but for those of us who have a real interest in public health sciences, the role of public health informatics looms large, and in my view at least, is underaddressed, especially when it comes to the challenges that people in public health have known for a very long time. How do you do the job, either as an academic or for a government or for industry, and do the kinds of analyses that are required, and at the same time manage the various kinds of privacy laws, which we independently value, but which sometimes produce challenges for us. So with that, Professor Schmit's at Texas A&M, the School of Public Health. He directs the MPH program and the program in health law and policy. We hold nothing against licensed attorneys, but he is one, just because I had the privilege of meeting Sandra Day O'Connor some years ago, the first woman on the Supreme Court that Arizona State College of Law is named after her, is kind of exciting. In any case, Cason's work bridges the way we think is important: health informatics, public health policy, and ethics. And he's got a number of noteworthy publications. You can read about more of them. With that, it's a privilege to welcome our presenter today, Professor Cason Schmit, who's going to share with us some thoughts about pandemics, privacy, and public health preferences, and how the law can improve all of them. Professor Schmit, the floor is yours. Thank you.
Thank you so much. That was a very warm introduction. I am just delighted to be here. I'm grateful to be here, and I'm really excited to share a body of research that I haven't had to gotten a chance to talk about before. So it's something I'm really excited about. I'd love to hear some of your thoughts, because we do a few things that are a little bit different than we think have been done before. But before I really jump into things, I do want to acknowledge that this body of research is a product of interdisciplinary collaboration. And there's stuff in that I'm going to talk about today that I could not have done without the expertise of folks that you see here. And I just think that's important to acknowledge right off the bat. I do have some real quick disclosures. One, this research was partially funded by internal funding through Texas A&M University. No major conflicts of interest. This is educational material, does not constitute legal advice. I am a lawyer, but I am not your lawyer. So don't take anything that I say as legal advice. Also, I do want to mention that Ken said I should have fun with this. So I'm sorry, but here we go. I want to start off perhaps a little bit differently than other research talks. This is a talk covers a few different papers, and instead of kind of covering them in the sort of traditional sense, I think it's better to weave them together in more of perhaps a narrative arc. Than sort of the traditional background, methods, results, discussion, yada, 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 over and over again. But let me start at a point that Ken made at the top of the hour, that public health informatics is a field that isn't talked about all that much. And one of my personal beliefs is that part of the reason for that, not one reason for that, is that the privacy framework, the data protection framework, legal, policy, practice, all the components that go into that, is structured in a way that makes sophisticated public health informatics quite difficult, particularly when it comes to incorporating social determinants of health into the informatics approaches that we take. And currently, right now, we are in this glorious window of opportunity for new policy. We've got federal, state, local governments are all considering privacy as a really important issue. And on top of that, we're in a period of health data modernization where we're looking at improving the infrastructure nationally. And when I say infrastructure, I also am talking about the policy frameworks that govern how data are used. And so with that moment of sort of galvanizing hope here, I'm going to start my presentation off talking about everything that I think is wrong. Well, maybe not everything, but a lot of the problems that go on with privacy as it is today. And from this point, I'll talk about why I hate privacy surveys. This is a bit of an exaggeration and a bit of overgeneralization, but sometimes I get a little bit flustered and trying to interpret what I see in many privacy surveys. And from there, we get to our third chapter, which is apocalyptic serendipity, as I will call it. And from chapter 4, we start talking about our results and what I think are somewhat surprising results. And our next chapter, the plot thickens. Then as we start to interpret this, lessons from the unexplainable, and finally wrapping it up with talking about how we can improve public health policy with better data protection law. So let's talk about the problem with privacy first, right? There is this, in the United States, a patchwork of laws that frustrate cross-sectoral data use, right? And this patchwork is characterized by different laws that apply differently depending upon where you are, jurisdiction to jurisdiction, who you are as a data custodian, what you intend to do with the data, and what the data are. What is in the data? What type of data are we talking about? Now, if any of those things is different or is changed, you might have an entirely different privacy framework or data protection framework that applies to it. This creates a lot of confusion and in some ways, inconsistency. And one of the ways that organizations, whether we're talking private sector, public sector, one of the ways that organizations deal with this is by adopting conservative practices when it comes to novel data uses. If they haven't done it 1,000 times before, they're going to be really hesitant because they're unsure about the legality of it. And it's hard to question to figure out. Now, the complexity of this framework creates both real barriers to data use where there is actually a law or legal provision that prevents the data being used in a certain way. And there are also what I think is probably even a greater problem of perceived barriers to data use, where someone believes that there is a legal impediment to using the data when the law isn't exactly actually prohibiting such a use. And some of the implications of this that I see quite often is that often laws will over-restrict uses of data that many of us see as having tremendous social benefit. They contribute to the common good. Whereas other data uses that are perhaps under-restricted or not restricted at all. They fall in our, legal loopholes, right? But they're actually really concerning. And so it's a very complex patchwork that has holes that allow certain practices to go unregulated. And in the context of public health informatics, which, if it's fully going to lean into analysis of social determinants of health, it requires data from these various sectors that might be governed by all of these different laws. As sort of a personal side, one of the things I am really interested in addition to privacy law, is the ways in which laws either align or don't align with ethical frameworks. And so oftentimes as I'm doing this work, I like to compare what I see in privacy laws in terms of permissions or restrictions, and compare that against what some ethical guidelines might say is perhaps an obligation or something that should be avoided. Okay, so with that, I asked the question, well, how do we build a better privacy law? Well, one way we can go about the policymaking process is, leaning into our democratic ideals. Let's go ahead and ask the public what the public wants. And indeed, what I'm going to be talking about today is going to cover several different privacy surveys of the US public about what they think about data use. And as I lay that introduction on, we get to the next chapter, which is why I hate privacy surveys, as somebody who does them from time to time. And one of the reasons I struggle a little bit with privacy surveys, and particularly interpreting the results, is there are a number of different phenomena that occur when we ask the public about privacy that make it really hard to take what we see as our findings and interpret them in real world settings. And the first one I want to mention is this well-observed phenomena called the privacy paradox, where this is a phenomena where people may express strongly held views about privacy, but they are observed subsequently to readily give up or their privacy or their personal information for relatively little benefit. And this has been observed over and over again, but here are some quick examples. We've got Alice, who really values her privacy, but then she shares her personal information to join her store's loyalty program, and thus allows that store to track all of her purposes or her purchases and understand more about who she is as a person. We've got Ben, who values his privacy, but he uses a free mobile app that sells his data to large data aggregators. Again, giving up your privacy, your strongly held belief, or at least inconsistent with that, so that you can get this relatively minor benefit. Maybe it's a flashlight app, or maybe it's it doesn't really matter. Now, this phenomena means that when you see a survey result that says, yes, I really care about privacy, or I really am skeptical about this type of use, is like, how much is that applicable in a real world setting? How is that generalizable when we know that there's this conflict or inconsistency with these expressed beliefs and actual behavior? And now, there are plausible explanations that reconcile some of this inconsistency. Solov is one person that, advances the notion that's really not that people are being inconsistent. It's that there's just this really high cost to managing our own privacy. And I would put that entirely on this paradigm that we're in the US privacy framework of the notice and consent, where that's the default rule, is that you have noticed that this is how we're going to use data, and by using our service, then you give your consent. And that leads to, of course, the 50 page forms of that no one reads. The other phenomena I want to talk briefly about it is one that I've observed over and over again in my own research, talking to the public. I'm going to call it the have the cake and eat it too phenomenon. And this is where expressed attitudes are either inconsistent or impractical given real world limitations. So let me give you an example of the type of thing that I see in some of my work over and over again. We've got Carol. She is really supportive of giving her data up for research and having her be part of research efforts. That's something that she really, really values. But she really wants her data to be completely de-identified. And these two opinions, attitudes are not incompatible, but there is a little bit of friction because de-identification does reduce the utility of her data in the research efforts that follow. So there's a little bit of friction there, and how do you, as a researcher, try to understand? So, well, would she answer the research question the same if she knew that there was a utility cost to de-identification, or vice versa, right? And then another thing that I also see is, let's say Carol also wants to give her consent before each use of her data. Well, now if we look at the de-identification preference and the consent preference, those are basically incompatible preferences, right? If data are completely de-identified, then how are we going to find the person to ask consent? And if they don't give their consent, how do we find the record to remove from the data set? And so, here again, how do we interpret these results? Which do they prefer more? Do they prefer de-identification? Do they prefer consent? Are these, it just makes it really difficult to understand how expressed attitudes in a privacy survey apply in real world settings. So one of the things that my team has been trying to noodle with and experiment with are different ways that we can try to ask about privacy and try to build in some real world limitations. I mentioned before that oftentimes there's a balance between privacy practices and the utility of the data. So de-identification is a good example here. This is an example of a question that we've kind of played with, but we haven't deployed yet. It's the idea of, like, if we were to ask a member of the public, would they prefer high privacy if it meant that data isn't very useful in research? Or would they move that little dot on the slider such that data is more useful, but they're giving up more on the privacy in order to do so? And where on that curve might they, in terms of privacy versus usefulness of data, are they comfortable, or do they like that balance? Again, we haven't really deployed this. We're still kind of noodling on whether or not that this question could work. It's kind of a complicated conceptually. But here's an example of a question that we have deployed that does put a cost to a certain answer in a privacy question. So in this question, we might ask the member of the public, you've got $100,000 to spend on research using existing data. And how much of that $100,000 would you spend on practices for privacy, confidentiality, security, research quality, or research speed? And in this type of question, they can't say, well, I want the highest quality research, $100,000, and also want some privacy. They've got to find out where their comfort is with the budget that they have. And so this is, again, a way that we can try to put real world limitations, or at least simulated limitations, on the questions, try to understand a little bit more of the nuance and how they understand some of these trade-offs. Another way that we could try to ask about privacy a little bit differently, and this is going to be the bulk of what I'm going to talk about today, is what if we were to treat privacy law as a product? And if it was a product, what features of the public, our customers, what features of that product would they want? And so we borrowed a type of analysis from product marketing, conjoint analysis. So here's an example of a conjoint question that you might see in marketing research. We've got 3 computers here, and each of the computers has different specs. The question you would ask is, if you were in the market to purchase a computer, which of the following computers would you choose? Now, in a conjoint analysis approach, there are attributes, which are some qualities about the thing that you are trying to understand. In this case, we have got attributes of processors, memory, and display. And within each of those attributes, there are levels. There are variations of an attribute. So in terms of our processor attribute, we've got variations of 2 gigahertz, 3 gigahertz, and 4 gigahertz. And by asking a lot of these questions about which they prefer, we can start to understand what attributes and levels of those attributes of a computer customers prefer, or so they select for, or maybe they select against. And this helps us as marketers understand what products we should build to meet consumer needs. But we can do the same thing theoretically from a policy perspective. So let's look at what this might look like for privacy law. So I've showed these bullets to you before, and I was a bit of foreshadowing, because if we focus only on data custodians, purpose of the data use, and data types, really we've got fundamental attributes of privacy law. Who's using the data, what they're using it for, and what type of data is, what is the data, right? And we can come up with different levels of these attributes and run a sort of market analysis on policy preferences. So here are some different federal privacy laws. We've got HIPAA. Everybody knows HIPAA on health data. We've got FTC Act that applies to commercial data. We've got Privacy Act, which applies to government data. Common Rule Regulations, which applies to research data. And we got Family Educational Rights and Privacy Act, FERPA, which applies to education data. And so what we did is we took a look at some of these examples of federal privacy law, and also took some inspiration from state laws. But from these, we abstracted different attributes, the who, purpose, and source of identification of identifiable data, and the levels of those attributes. So in the context of this research, we've got who's using the data. Well, it's either the researcher or a university, a nonprofit organization, a government, a business. What are they using it for? Well, it's either for research or science. It's for promoting population health, identifying criminal activity, marketing, recruitment activities, or profit-driven activities. And what type of data are we talking about? We've got education records, health records, government program and activity data. So this would be your administrative data, economic activity, or customer behavior data. And using these attributes and these levels, we can create conjoint questions. And this is an example of a question that we gave to our survey participants. We essentially gave them 2 different data use scenarios. And we asked them, which of these 2 scenarios would you be more comfortable with? And so they would choose, here we've got a nonprofit organization that is using economic data to promote population health, or we've got a researcher using education records for research or scientific knowledge. And they would choose one or the other. And we ran this, we gave each participant a bunch of different questions and ran some analysis to calculate the preferences and for the various attributes and the levels. Survey overview really quickly. We used web-based survey, and broadly, all the questions related to comfort levels with data reuse. And for all these questions were specifically about using individually identifiable data that is used without consent. And this is important because in the US, privacy law largely applies only to identifiable data. So for many different privacy laws, if it's legally de-identified, whatever that means or however it's defined, the law doesn't apply, the restrictions don't apply. And without consent, because for most US privacy laws, if you have consent, you can do whatever you want with the data, right? And so by assuming it's without consent, we are really playing with what privacy laws actually allow or don't allow. We use a third-party research company, Dynata, for the surveys that we're talking about, and they are really good at trying to, they use a panel of their respondents to try to identify as close to a sample as you're targeting as possible. And we identified 6 census-based sampling targets: gender, race, ethnicity, age, education, household income, and religion. And for our, to try to get as close to nationally representative samples of those targets as possible.
Cason, I'm going to interrupt very briefly. Either you misspoke or you didn't say what you meant. Region or religion?
Region.
Super.
So like census regions.
Okay, perfect.
Yeah, great
Thanks.
question. Did I say religion? Ooh, okay, definitely region. Thank you for clarifying. So for our statistical analysis, and I'm a lawyer, don't ask me many questions here, but we use a hierarchical Bayes regression model and a Markov chain Monte Carlo simulation to do those estimates of the various attributes and the levels. And we used, and I can speak a little bit better on this, non-overlapping 84% confidence intervals to identify statistically noteworthy differences between values. And this might jump out at a lot of folks who are used to seeing 95% confidence intervals as sort of the standard. Well, it turns out that if you look at non-overlapping 95% confidence intervals, you're actually looking at highly statistically significant differences between those two values. And closer to 83%, maybe a little bit above 83%, is where you are most likely to approximate or most closely approximate the 0.05 p-value, equivalence of statistical significance. We chose 84% to be on the little bit more conservative side. But broadly speaking, there is no standard recognized statistical test for the type of conjoint analysis that we did here. So this is the best that our biostatistician on our team came up with. But yeah, any questions on any of this before we start diving into some of the results? Great. So our sample, 504 people, and we were really close to many of our sampling targets. So we were happy that this was as good of a representative sample of the US population that we were going to get given our constraints in this survey. And here were our sort of principal findings. So I'm going to spend a little bit of time to try to help you understand what you're seeing with this chart. When you see the positive numbers on the right, those indicate preferences for. So these would indicate higher levels of comfort. When you see the negative numbers on the left, you are seeing lower levels of comfort, or perhaps preferences against a specific attribute or level. The bigger bars indicate stronger preferences, either for or against. And the values that are closer to this mean line indicate maybe a more neutral or maybe agnostic view of an attribute or level. So as we look at these results, we've got our whose attributes in blue, our red attributes are our purpose, and the green attributes are the source of data. So generally what we saw, and as somebody who studies public health data law, I got really excited about this because one of the most important attribute levels here is the purpose of promoting population health. Now, in the purpose section, we tend to see the stronger preferences. Slightly less strong preferences in the who, but still pretty large values. And then, it turns out that people don't have as strong views as the data type. And this is really interesting in our US data protection sort of patchwork, because data type is a really sort of significant thing that we latch onto in terms of drafting our privacy rules. And it turns out the US public is, more indifferent than opinionated when it comes to that. So the public tended to be more comfortable with universities, researchers using data, nonprofit organizations, less comfortable with governments and businesses. In terms of purpose, they really liked promoting population health and research, more skeptical of identifying criminal activity, and very strong preferences against for marketing and research, as well as profit-driven activities. Education record was the highest preference, and this surprised me quite a bit, as there was kind of a high preference for health records in this sample, and then less of a preference for government program or agency and economic data. Now, what I find really fascinating and interesting is that when you look at the most preferred and least preferred data scenarios, which you see here, we see university public using education data for public health, right? And for those of you that are familiar with FERPA, know that this is not within one of the allowed exceptions to consent in FERPA. So the most preferred data reuse scenario is actually prohibited by US law, which is really, really interesting. And then when we look at the least preferred data use scenario, we've got businesses using economic activity data for profit-driven reasons, right? So this is basically illegal, widespread type practices, but the public is most concerned about this data reuse scenario in our survey. So I love this, right? Because I am always sort of comparing the law against either ethical frameworks and here against public preferences. And there's this wild incongruence that's going on. Now, this was a very exciting survey, but we also did this survey in February of 2020. And as we all remember, February of 2020 was this wonderful and beautiful, peaceful, carefree time in the world. And then some things happened, right? We've got global pandemic. It was declared the next month by the WHO. And then here in the United States, we also just had these explosions of social movements. From the killing of George Floyd, we had the explosion of Black Lives Matter protests. We also were in a hyper-partisan 2020 presidential election in which people were just constantly, debating in public spheres about public health and these social movements and other things. And so we asked ourselves, like, well, do the data we just collected mean anything now? Like, did everything in the world change, including the results that we just collected? And so we decided that we were going to take advantage of this crazy moment in time and try to do a little bit of a sort of natural experiment-ish, right? Where we are going to redeploy the survey and see whether or not any of these attitudes or preferences had changed given the real world and earth-shaking events that occurred. And so we did just that. And in November of 2020, we redeployed the survey with more participants this time. And we did it in November, and we cut off our data collection to right before the results of the 2020 presidential election were declared. And the reason for that is we were really hoping to capture sort of that crescendo of I don't know, politics and debate and those sorts of things. And so again, we used Donata to try to get a similar sample, and we again largely met our sampling targets. And so, without much more to say, here were our results. And this was shocking to me, right? I was expecting a lot more movement. Here on the left, we have our February results. Here on our right, we have our November results. And yeah, there is some movement. There are some values that tend to be higher, tend to be lower. But what we see is in the distribution here is among especially the who and the purpose, the pattern is remarkably resilient and stable, that we just did not see much movement at all between those two points in time. And so what I'm going to do right now is show you some of the demographics, the different demographic groups. And I want you to try to pay attention to the patterns. But before we do that, we're going to normalize, right? So what you're seeing here is the exact same chart, just the scale has been tightened up. And that's because this is the format of all the other demographic groups that are to follow. So I want you to normalize here. This is exactly what you saw before. And I'm going to move a little bit quickly through the next few slides that are all going to be formatted the same way. And again, I want you to just pay attention to the pattern of high comfort for up here for research or university, nonprofits, lower comfort for government and business, high comfort for promoting population health and research, lower comfort for marketing and profit-driven activity. And we're just going to go through it. All right, so this is everyone. This is the white subgroup. This is Hispanics. This is Asians. This is our male subgroup. This is our female subgroup. This is income lower than 20,000, 20,000 to 50,000, 50,000 to 100,000, over 100,000, education, high school or less, some college, college and over. And I hope as we sort of flew through those, you can see that just there's striking similarities across all of these subgroups. And that was really, really surprising for us. But surely, given the hyper-partisan political battles that were being waged, particularly over the COVID-19 response, we're going to see some differences in Democrats and Republicans, right? This is what blew me out of the water. Now, both of these are November because we didn't collect political party affiliation data in the November survey. I'm sorry, the February survey, but we did in the November. So both of these are November, but again, both political parties have high comfort levels relatively for researcher nonprofit organizations promoting population health and research. And this is great because even if we are pushing forward, this provides a window of opportunity to push forward on privacy legislation that actually benefits public health informatics. It benefits research because we have consensus. There seems to be consensus across the political divide here. So again, I think one of the principal takeaways here is just the remarkable similarities and resilience across all of the subgroups throughout 2020. except one subgroup that had us scratching our heads. And this was from our African American respondents. As you see in the February survey, again, we have strong support for public health, strong support for research, and then a lot of skepticism for marketing and recruitment and profit-driven activity. But when you go to the 2020 results, those preferences are just gone. It's just this strong shift towards neutrality or perhaps agnosticism on most of these measures here. We're talking an over 50-point drop for research and scientific knowledge and a 35-point drop for promoting population health. It is just a stunning and precipitous drop. You know, this is maybe what I might have expected overall on population level, but the fact that almost every other demographic was, you know, similar and resilient, it seemed to hit this particular subgroup much harder. So how on earth do we explain this? First of all, our experimental design, it's not really an experimental design, right? We ran 2 surveys and a whole bunch of stuff happened in between both. So it's really difficult to, and impossible to really attribute this to any sort of causation. But, you know, one of the things we're still trying to figure out is maybe what happened here. And so I'd love to hear some of your thoughts on this if you have any. One, there was a huge increase in systemic racism, or increased awareness in systemic racism during this period. We had high-profile events, the murder of George Floyd, which highlighted sort of the systemic racial injustices, nationwide protests that really galvanized the entire community. Privacy was also very salient in many of the protests, with pamphlets being handed out how to deal with privacy or tracking and those sorts of things. We also had renewed mistrust in health and research institutions. We had historical abuses that, you know, like the Tuskegee syphilis study. This doesn't really explain why there was that prior trust or comfort with those activities. But they may have been amplified or revived given the climate of 2020. I do see that there's some chat, so let me. Okay, yes, I expect this triggers population mistrust. Yes, and thank you, Dr. Brown here. You know, one of the things that, you know, also we're thinking of is, and perhaps there's synergistic interaction between these various possible explanations, but there were huge disproportionate impacts of COVID-19, both from COVID-19 itself, but also from the economic and social disparities that it exacerbated, and the public health response, you know, may have contributed to there. There was also this sort of these calls from the public about increased participation in vaccine trials and testing. And this might have been sort of like a burden or caused some similarities, some past experimentation on these populations. So I think there's, you know, a lot of possible explanations, and I'm glad that somebody brought up Dr. Page brought up the Tuskegee syphilis study, because one of our participants did. So we did collect some open-ended feedback in the November survey, and one participant really brought up a lot of different themes here: Tuskegee experiment, historical injustices, particularly the economic ones, how the poor tend to be experimented on and the rich tend to do the exploitation, and that there just really isn't an equity here in the balances of and burdens of these activities. So, you know, that is what it is. But, you know, to a large extent, you know, we can guess, right? And we can play with some of these ideas here. but we just can't know. It's hard to explain these changes that we observed. The takeaways that I get, sort of like trying to take lessons away from the unexplainable, as I teased earlier, is that trust in public health and research enterprises is fundamentally fragile, right? We saw what appeared to be indicators of trust, those high levels of comfort in February, and they were just gone in November. And, you know, I wonder if it's ongoing injustice, reopening these old scars over and over again, creating new scars. And this perpetuates mistrust. And, you know, I wonder, right, you know, the implications of this on this sort of social contract, the social license that we have with communities in public health and in research to use their data, right? And that this social license is precarious to injustices that, you know, are baked in not just our institutions, but all institutions and broader social environments. So at least those are my takeaways. But again, you know, it's something that, you know, an idea and thoughts that we're still wrestling with actively. Reflecting on some of the general findings, overall public health, public support for public health and use of data remained really remarkably strong. Generally, our results were consistent across all subgroups between February and November. Support was highest for public health research throughout 2020. And this was true across the political divide, Democrats and Republicans. And I thought this was particularly interesting because if you recall, one of the prevailing narratives during this time were many of the very public and very frightening threats against public health workers. And I'm not disputing that, and it's incredibly concerning. But underneath that surface, there appeared to be strong support across the political divide. The extremism may be more narrow than we previously thought. The lowest support, government business is using data for profit-driven and marketing purposes. Now, one of the interesting findings and important takeaways here is that we found that our findings were incongruent with national privacy legislation, right? That generally our findings support the use of provisions within the law that promote research use and public health use. But what you see here is a breakdown of about 20 different federal privacy or data protection frameworks. And that red and green column is the public health use where they are, right? And there's a lot of red, right? That actually the public health exceptions and privacy laws are quite rare. We have a green here for HIPAA and then green for 3 VA, Veterans Affairs privacy laws, and then a lot of red, right? And so there's an opportunity to try to advocate or to argue that the public wants broader provisions for the use of data for public health purposes. And those discussions about privacy legislation, particularly comprehensive privacy legislation, are occurring both at the federal and state levels. You know, most laws will consider health data, but they don't quite expressly address public health, and those are defined differently. So it's a big problem. So I've seen examples of bills that restrict data between nonprofits, data sharing between nonprofits and public health. That was widely supported in our sample. I've also seen bills that increase protection for race and ethnicity data, which are social determinants of health, right? And so those types of provisions without public health exceptions do risk stunting public health informatics on social determinants. There's also the health data modernization activities, which are ongoing at all government levels. I think our results raise questions about what it means to be a good steward of public health data. I've talked to a lot of state epidemiologists that take a lot of strong stances on protecting privacy of the data that they have, and that's good, right? That's good. But when there's broad public health or broad public support to use their data for public health purposes, it raises some questions about the level of stringency of the privacy protections. And maybe they need to be open to more uses in the public health informatics context than they currently are. So I do think that there is some opportunity to better align state laws given with the public preferences. All right, a lot of references here. The two citations in the bold are the two papers that I talked about in detail today. And I'd love to talk more about them. I think we got a little bit of time, hopefully enough time to chat.
We do indeed. Thank you so much. We all sit through lots of talks, but precious few end up having your audience say, hang on a second, that is interesting. And what's to be done about it. So Cason, thank you so very much. This is exciting research. And when I learned about it, I realized this is something that I want to learn more about. When we first met, it was based on vague views, based on a little work by a colleague of ours that seemed to show that ordinary people assumed that trusted authorities were actually constantly analyzing their data, because that's the way public health works. You can't have you can't monitor food, air, water without constantly snarking up data. Or more recently, including at the University of Miami, wastewater sampling, which some people instantly get and other people find bizarrely intrusive, and there's maybe, who knows, maybe an aesthetic component to all of this. But that's just to say 3 cheers. Are there comments and questions from others here? Otherwise I'm going to monopolize everything. So while people are framing their thoughts, you offered $100,000. One of the things that I'm thinking, and I assume it's not a unique thought, the limitations of your study are not so much limitations as here's when you did them, right? Imagine you could do this every year. Get ongoing, like a sort of Framingham for for public health data use, right? And we'd be able to track this, because the stability, what leaps out, of course, is broad, with one noteworthy and important and dispiriting exception, really good inter-rater reliability on these issues. People support this because they realize in some way that who knows who will explain it, that there's a real benefit to me, to you, to us, by having public health science do this on an ongoing basis. I trust you. We know where it comes from. Other people will say, well, that's just way too woke for me. That's your big nanny state trying to infringe. Y'all try to save too many lives, and that's we can't stand for that. What other reactions are you getting when you share these thoughts with people?
So I think most people are surprised by the similarities. One of the interesting things, and we have a person at our university who likes to promote our research as it's been published, and I got a draft of one of her sort of posts before it went out, and she was really focused on differences, like where are there differences? And I think so much in research, right? We are focused on how are things different. And in the policymaking process, I think focusing on the similarities is much more powerful and impactful because it provides a path forward. I'm in other work that I'm doing, I am working with some vulnerable communities, both urban and rural, on their views on public health surveillance, and toying with this idea that maybe there's this ethical, not legal, but an ethical right to be counted. And I continually be surprised at how often and that communities they want to know if there is a health threat facing them and their families and their community members. And, to a certain extent, that surprises me. I'm a believer that there is this right to be counted, and one that is often in conflict with the assumption that we make in most of our privacy laws, is that privacy is paramount, right? And if there is a right to be counted, then we need to somehow negotiate where individual privacy must give way so that communities can understand the health threats they face. And it's my view that information is empowering. And from talking with some of the communities that I'm working with quite intimately, they believe that too. Now, interestingly enough, this is also too good of a coincidence. We started working with some of these communities before the 2024 election, and we're about to deploy a survey with them to talk about specifically public health surveillance. And some of these communities have pretty high migrant populations. So, we are also throwing a question in there about whether or not some of their privacy views have changed since the election. And we'll see. Yeah, I think there's some shift here.
The right to be counted, if you will, reminds me of the too infrequently invoked right to benefit from science. Which are peas in a pod, I suppose. Namely, why would you not want your babies to be healthier because someone analyzed de-identified data and gave you interesting, important information to help make you and your family healthier? Reverend Shirley has been active in the chat. She's pointed out that we'll draw to a close with your final thoughts about how that legacy of distrust, specifically in the African American community, might be dealt with. That's a dispiriting problem for us, because most of the people who are doing the surveillance, and most of the people who are doing the analysis, and most of the people in public health understand the problem of systematic racism. They are worried about inadequate diversity, equity, and inclusion. There, I said it. In the University of, shout out to our UF colleagues, but you're not allowed to say those words in the state university system in Florida.
Or in Texas.
Yeah, well, there you go. So at the risk of being unutterably woke, as a matter of fact, there's a bold-faced empirical case to be made and an uncontroversial moral obligation to address it. Anybody who disagrees is mistaken. Well, so perhaps not everyone agrees with that. And so your thoughts, Cason, by way of closing, about what can we do in marginalized communities?
So I think a couple of things. One, to a certain extent, past is prologue, and we can look at the changing administrations and the differing stances that occurred between data sharing for public health purposes in 2020 to January 2020, or 21, sorry. And we saw some shift there. There were lots of states that were really reluctant to give the Trump administration their immunization data, and raising the point that it could be used for the surveillance of, or to help enforce immigration policies, right? New York, California were some notable examples there. And the shift of administration changed those views, right? Or I don't know, it wasn't, you can imply it by all of a sudden their ascension to some of these data sharing agreements. And we can probably see some similarities happening there. I am a strong advocate for sharing more data with public health. I am probably a stronger advocate of not sharing data outside of public health. And what I mean for that is we need heavy guardrails to ensure that the data that we voluntarily share as part of the social contract to make our communities better isn't used to harm individuals within our communities, right? It isn't used to prosecute individuals in our communities. And so, I do think that the concern that data that is shared with public health might be used for other purposes is something that is going to undermine our efforts to promote population health. And I do think we need those guardrails to ensure that we're not sharing data with law enforcement, Homeland Security, or anything for purposes unrelated to public health, strictly speaking.
Brilliant conclusion to a wonderful talk. Cason, thank you so very, very much. Thank you to our colleagues. We had an interesting group here. Thank you to our colleagues from the University of Florida, Cleveland Clinic, Nova Southeastern University. We've pulled together a bit of a dream team for you, Professor Schmit. Thank you so very much for a really important presentation.
Happy to be here. Thank you so much.